We talk a lot about global health in our organizational reports, in program strategies, in that billion-dollar conferences we organize around the world every time. But let us be honest, what do we mean when we say it? Because if that small rural clinic in a forgotten village does not matter as much as the big national teaching hospitals in our plans, then we are really not telling the full story. For a lot of people, global health sounds like something far away, something that happens in Geneva, New York, or Nairobi, something that is discussed or written as policies in boardroom meetings, at a summit, or during emergencies splashed news across media platforms. It sounds big, complex, and maybe even untouchable. But here is the truth. Global health is not global if it does not include rural health. Let us break that down. Global health is in that village where the nearest hospital is far away. It is in that rural clinic in a faraway village in Gombe State, Nigeria, where one nurse sees dozens patients daily. It is in that dusty road or flood-prone district in Sudan or Bangladesh where a health worker has to trek miles just to check on a patient. It is in that volunteer-run hospital post in rural Guatemala. It is in every community, rural, urban, remote, where people fight for the right to care. These are not afterthoughts in the global health system. They are the system, or at least they should be, because global health is local health. It is not about distance, it is about equity. I repeat that again. It is about equity. As Dr. Agnes Binagwaho, the former Minister of Health in Rwanda, once said, the health of the most vulnerable must be the starting point of any global health agenda. If we center global health strategies on capital cities, on shiny hospitals with research grants and media attention, then we are missing the majority of the people who are experiencing health issues around the world. Let us look at the numbers. You know that I love numbers. They are quite telling. So, according to WHO, which is the World Health Organization, nearly 44% of the global population lives in rural areas. And in sub-Saharan Africa, it is over 60%. Yet, rural communities consistently have the lowest density of health workers, limited access to essential services, and they are often last in line when it comes to receiving innovations, vaccine, or health funding. That does not only show a gap in access to health care, it's also evidence that government has failed in these areas. Because if a child dies in a rural clinic because the only nurse did not make it to work that day, if a pregnant woman must travel 40 kilometers by motorbike just to deliver her baby, and if a health worker have to keep showing up unpaid, undertrained, and unsupported, that is not local problem. Those are global consequences of rural health negligence. Health systems do not break apart neatly according to regions or by regions. They ripple, disease travel, they move, misinformation spread, and when rural communities is left unattended to, it also weakens the collective resilience that we all depend on. So we must stop treating rural health as peripheral issues for development goals in big summits when we attend conferences, and start seeing rural communities as strategic infrastructure, as a place for core global health emergency preparedness, and as a place to center equity. If the goal of global health is to ensure that people everywhere can live long and have healthy lives, then we must prioritize places where the goal is farthest from policy reach. And that starts with making rural clinic matter as much as that teaching hospital in the urban area. To do this, we must, as a matter of urgency, begin to, number one, fund primary health care like we fund vaccine research and development. Number two, we must start treating community health workers like professionals and not just volunteers. And number three, we must begin to recognize that a strong global health system is one that works from the ground up and not from up down. Global health is not out there, it is here, on our dusty roads, in our crowded waiting rooms, in that quiet dignity of a nurse who refused to give up on her community. So, the next time when we say global health, let us mean it and let it be a reflection of the global community. My name is Chinasa Imo, and I will continue to ask, what about rural health? Let us create that narrative together. Thank you very much for listening to this monologue. If you like it, please share it and follow us in all our social media platforms at whataboutruralhealth.com. Thank you.